So I have Luca's knee here. So just gonna do a valgus and Lachman's just to see if the MCL and ACL is intact. So with the MCL, I'm just gonna grasp at the posterior aspect of the calf. And so with full extension, you're targeting MCL, but also a little bit of the ACL, PCL, and medial posterior capsule of the knee. So with the left hand, I'm just going to try and drive a valgus force laterally. So another turn, I'm just going to have my hand here, stabilizing here and pushing in. So I'm just looking for any laxity, any painful expressions on Luca's face, which I don't see. This is basically just gapping the MCL between the two condyles. So then at 20 to 30 degrees of knee flexion, this more targets just more of the MCL, it's more specific. So again, I'm just having my left hand and then driving it forward, or driving it inward. Again, looking for laxity, painful expressions, any hypermobility compared to the other side, which I need to still assess. So same thing on the other side. At 0 degrees, you're testing a lot of other structures. So we're just applying a valgus force, trying to gap the medial side of the knee. And if I go in 20 to 30 degrees of flexion, this is a little bit more specific just to the MCL. So again, stabilizing the posterior aspect of the calf, and then we're trying to drive my arm inward to try and gap that medial collateral ligament. And if you did have an MCL injury, there'd be a little bit of pain and a little bit of laxity just on the medial side of his knee. And then next I'm going to do a Lachman's just to see if the ACL is intact. Luca's really bad at relaxing, so I'm just going to put a pillow underneath his thigh. I know like that might not be the best thing to do, but it's the only thing to help him relax his thigh so I can see if there's any anterior translation of the tibia. So with my left hand, I'm just going to grasp on the anterior aspect of the thigh, and then my right, I'm just going to have my thumb landmarking near the tibial tuberosity. Just going to get underneath near the popliteal fossa. What I'm going to basically try and do is just try and anteriorly translate the tibia while stabilizing the thigh to see if there's any gapping and see if I have that snapping motion of the ACL to prevent that anterior translation. So that seems pretty normal, but just to make sure, I'd have to check on the other side. So I'm just going to slide the pillow underneath his left leg, making sure he's completely relaxed. So again, right hand's stabilizing the anterior aspect of the thigh, left hand just go landmark near the tibial tuberosity, and my fingers are just going to be underneath the popliteal fossa. And so again, I'm just going to look for that snapping motion. Looking at Luca's face, doesn't seem any painful expressions. I'm just feeling that snapping, kind of like snapping of a belt, which means that his ACL is intact. And comparing bilaterally, don't see any laxity or hypermobility. And yeah, so that's Lachman's and valgus to test the MCL.